The reason, I mean, in fact, the reason why patients are getting more and more obese around the world is simply because patients eat too much. The volume is too, the quantity of food they eat is too much. And obviously, in India, if we talk about the problem in India, India is a country which I visited when I was 19 years old and 20 years old. I spent 6 months twice in India, and is nowhere patients were at this time big at all. I remember I traveled around, so I was, it's about 30 years ago, because I'm 50 years old, so, and in about 30 years time, what's happened is in India became a lot wealthier, and this is great for the country. The country is emerging country. It's a lot of people, middle class particularly. The middle class is raising enormously, and basically is what you see in a lot of different places, in different countries. It's just a matter of getting more money, basically. Then they eat more food, they have more banquet, they have more going out, and then basically the populations get bigger. And it doesn't surprise me. I visit some country, let's say in Vietnam, for example, or in Cambodia. I did some charity work a few years ago. Nothing to do with obesity, and it's no obese patients up there. None. I couldn't see one. I would hardly see one. You visit some place like in the US, so it's an enormous problem. You go to some place like in China. China is a bit like India, in fact. In China, it was no big people before, and now it's a big problem. So bariatric surgery in China is now a huge problem and to address. And the unique, really, way to deal with this patient, and then this has been published, studied, for long term, is at the moment surgery. Surgery for morbid obesity gives you a very long term result, and because the technology and all the instrumentations have changed so much, it's become extremely safe to operate any kind of obese patient for obesity, the same that we do gallbladder and hernia. This is the reason.